While many people in Iran are still denied access even to the country's limited internet, videos that have emerged from Iran in recent days point to a catastrophe virtually unparalleled in human history: the massacre of tens of thousands of people over the 2 days of 8 and 9 January. Some estimates indicate that tens of thousands of people in Tehran and other Iranian cities were killed by the Islamic Revolutionary Guard Corps during those 2 days, when millions of people poured into the streets chanting slogans against the Islamic Republic, and that far greater numbers were wounded.
جوانای مردم سپر من کجایی بابا سپر بابا کجایی بابا
However, as some of these videos began to circulate, forensic medicine specialists identified deeply disturbing evidence, namely execution-style shots fired at the heads of wounded protesters. An Iranian nurse and an Iranian physician, in separate conversations with me, confirmed that they had witnessed wounded protesters being abducted from hospital corridors by security forces, and had also received reports of the street execution of injured demonstrators. An Iranian human rights organization has even reported that a young protester who was wounded during the shooting survived after spending 3 days inside a body bag until he was eventually rescued when families of victims stormed the body storage facility in Karizak near Tehran. He has said that he heard the sound of execution-style shots being fired at wounded individuals who were being held there as corpses.
These medical observations support the inference that the gunshot wound was sustained after hospital admission while the individual was lying down. These findings are consistent with the report provided by the healthcare personnel at Sina Teaching Hospital in Tehran, while they reported that the injured patients were forcibly removed by security forces from post-surgical recovery rooms.
These crimes, carried out with the participation of the Islamic Republic's proxy forces in the streets of Tehran and in most large and small cities across Iran, have shocked the international community. A member of the medical staff in Tehran told me that the violent conduct of IRGC forces toward large numbers of wounded patients in hospitals has left many healthcare workers suffering from severe psychological shock. At the same time, numerous reports indicate that some wounded protesters remain in hiding in their homes for fear of being abducted by security forces, while others have buried the bodies of their loved ones at home. The execution of wounded protesters, documented in multiple reports within medical networks, is an act without precedent on this scale and has further fueled public anger and revulsion.
From London, Amit Habibiniya reporting for the Media Line.